I'm so excited to introduce you to a very special person to me. Today, the Revive family likes to welcome Dr. David Gerth, who's joining forces with us. I've known David for over 10 years now. We came across each other actually at University of Miami, where at the time I was a faculty member and David had just started his plastic surgery fellowship. I feel honored to have had a very small hand in his training and who he has become. I've watched him as we both have had our practice here in Miami as he's grown to a very successful aesthetic and reconstructive plastic surgeon. David has a very special background, which is very unique, and he brings a lot of expertise into the field of plastic surgery. He has training in ENT and also in facial plastics. He's triple board certified. If it was just one of those was not enough. So he has a very unique take on specific aesthetics of the face, but he's also a very capable body surgeon. What are some of your favorite procedures?
Like you mentioned, I do have a strong background in the face. So obviously, I enjoy facial rejuvenation procedures. The deep plane facelift, minimally invasive brow lift, and mid facelift. I really enjoy rhinoplasty, especially reconstructive or secondary rhinoplasty. I think patients really get a lot of satisfaction out of the change that I can provide for them.
You mentioned deep plane facelift. Is that your sort of go-to procedures for most of your patients, or do you have different approach for different people?
Yeah, so if I have a patient that's got superficial fat and the skin is really good skin quality, not loose, that's a great patient for liposuction. And you can combine that with if they got a weak chin, you can do a chin implant at the same time. Those procedures really complement each other well. Now, if the patient's got a lot of deep bulk, we have to change it up a little bit and do what's called a structural neck lift or deep central neck lift, and it addresses the tissue deeper in, and that's how you get the result with a different kind of patient.
Now, I've also seen some amazing results of some of the patients in whom you've done liposuction or fat transfer or done tummy tucks or even breast procedures. What are some of your favorite aesthetic procedures in the body?
Yeah, the body really provides a lot of, wide range of options, including breast and body contouring. So I definitely enjoy breast surgery, especially augmentation mastopexy, because you're going to get the biggest change with that patient. And usually those patients, they've gone through breastfeeding, they've had several kids, and they just want to wind the clock back a little bit. So they're really appreciative. And
Mhm.
that brings me to the other surgeries, which is a mommy makeover. And as you know, that can be a wide range of things. It could be any combination of breast and body procedures. But again, those patients, they just want to wind the clock back a little bit. They want to address the changes that childbearing and motherhood have brought to them. And they're super great patients. I love having them in my practice.
So this has been a very exciting exchange of information. I'm actually really glad that I have another skilled physician in our practice so we can actually bounce ideas against each other. It's been a pleasure. I'm also looking forward to having more of these interviews, which we're going to share with you regarding specific topics in plastic surgery.
Thank you again. I'm thrilled to be here. I couldn't be happier. And I look forward to meeting all of you.